Hi, my name is Dr. Shane Stedman with Integrated Brain Centers in Denver, Colorado. We specialize in helping people who have suffered from the effects of a concussion or a traumatic brain injury. In this video, I want to explain what mild or subtle symptoms of a brain injury can be, what we see with patients in the office, and what can be done. When patients have a concussion or brain injuries, we often think of some of the big signs and symptoms like vertigo, the inability to work, vomiting, headaches, and the slurring of words. But often there are more subtle signs of a concussion, and those are the symptoms I want to talk about in this video. When someone experiences a concussion, there can either be a shearing motion or a quick acceleration-deceleration of the head. With both of these motions, it can affect the areas of the brain known as the brainstem. The brainstem is a very important area of the brain in which other areas of the brain stimulate and feed into. The brainstem is involved in functions such as respiration, digestion, swallowing, blinking, eye movements, and head movements. Another important feature is that 90% of information from the cortex goes through the brainstem. Therefore, if someone has dysfunction in areas such as the frontal lobe, you can also experience changes within the brainstem. When the brainstem becomes affected, either severe or mild changes can be seen. Some of the subtle symptoms might be a change in the heart rate, dry mouth, dry eyes, blurred vision, difficulty with reading, difficulty with concentration, and a sensitivity or light and sound. During our examination, most abnormal findings or alterations are found within the ocular motor system. The ocular motor system is an area of the brain that deals with such activities as the alignment of the eyes, how the eyes move, and how well we can fixate and follow a target. When the ocular motor system is dysfunctional, patients are often describing blurred vision, difficulty with concentration, and difficulties with reading. These subtle symptoms can take weeks to months and even years to manifest into bigger problems. Often patients don't realize that these are symptoms of a head injury because they're not as well known, such as nausea, vomiting, and headaches. When setting up strategies to rehab the ocular motor system, it's much like rehabilitating or recalibrating a piece of machinery. Most of us are aware that when a system is damaged or dropped, it needs to be repaired. The person doing the repair work often needs to recalibrate the system before returning it to our owner. In our office, we evaluate a brain that has been damaged or injured and find ways to recalibrate the system so that the patient can function again and perform their normal activities of daily living. Often in cases of head injuries, the first thing that needs to be done is to work on the ocular motor system. The ocular motor system is crucial in allowing the body to know where it's at in space and to help coordinate movements and vision. The ocular motor system becomes very foundational to the coordination of other parts of the brain. At Integrated Brain Centers, we utilize specific eye movements to rehab and recalibrate and work on specific areas of the brain. We now know that certain eye movements can affect different areas of the brain. For example, we know that pursuits or slow eye movements can affect the brainstem as well as areas in the parietal lobe. Saccadic activities or fast eye movements can be used to rehab areas of the brainstem or the frontal lobe. We know that eye movements in certain directions can have different results in the brain. With this knowledge, if we can put together specific strategies using eye movements for rehab, we tend to see quicker results. As you can see, these subtle symptoms are the earliest signs that you need to seek out a practitioner that knows how to assess people with concussions appropriately. If these subtle symptoms are not addressed, they have the potential to turn into bigger issues down the road. When looking for a practitioner, it's crucial to find out if they understand how to assess the ocular motor system, the brainstem, and the cortex. Understanding the specifics of brain function leads to develop a specific treatment plan to rehab a person suffering from the effects of a concussion. If you would like to know more about how our office can help you and to see if you're a good fit for care, call the number below today and set up a complimentary consultation. We look forward to meeting you. Thank you.